wild guess.
Chest wall tumor.
Yeah, very good. This is a chest wall tumor. So, what from this picture can you suggest what type of tumor is this?
Might be osteocyte. I'm not sure.
Yeah, very good. This is a bony tumor. You can appreciate the calcification, dense calcification over the tumor. So this is basically something to do with a bony tumor. So what are the common tumor of chest wall?
So Ewing's can be there.
So whenever you will be asked in exam about any types of tumor, types of something, you'll always divide this. Either first you divide this into either a malignant or a bone benign one, or you can divide in another way, tumors arising from the bone, tumor arising from the soft tissue, and tumor arising from the skin. Okay, because chest wall is composed of what? The skin, muscle, and bone. So you can easily divide. So bone, if you have the most common tumor being Ewing sarcoma. Next is a chondrosarcoma and osteosarcoma. If it's soft tissue, there is muscles. So what can be the tumors from there? Soft tissue. Keep in mind the most common tumor of chest wall is sarcoma. So what can be the soft tissue tumor from chest wall muscle? From muscle. When a sarcoma arises
abdomen sarcoma.
Huh?
Abdomen sarcoma.
Rhabdo. When a sarcoma arises from a muscle, what do you call them? Leiomyosarcoma. Okay. Obviously, you can have rhabdo, especially it's a child. If it is a child, rhabdo is a possibility. So there is fat inside the chest walls, inside the esophageal tissue. There can be liposarcoma, and obviously there is vessel and other connective tissue. So you can have other soft tissue tumors also. And from skin, chest wall, prone to different exposure of sun and other thing, obviously will have skin squamous cell cancer. And also you can have other skin cancers like BCC and rare tumors. So these are the most common tumors of chest wall. So can anyone tell me what is the treatment of Ewing's tumor? Basic treatment, main treatment. Suppose you find a small Ewing tumors inside in your lateral chest wall. What do you do? Do you operate this patient or do you do something else?
We start the patient on chemotherapy, sir.
Yeah, very good. So Ewing sarcoma is a systemic disease from very beginning, even if it is very small. So no Ewing sarcoma should be operated upfront. It should always be staged with a PET CT and a bone marrow if necessary. And then you give a chemotherapy, but these are very chemosensitive tumors. And if you can achieve a complete pathological response with chemotherapy for these tumors, then you excise it. That will give you excellent result. Otherwise, it's a very devastating tumor. Keep on cutting, it will keep on coming up. So never jump onto a sarcoma. These are very common in inguinal regions, chest wall, pelvis. Sometimes it's very small. It looks very nice to be a cup, very easy cup of cake to operate, but never do this. They always stage it, give chemotherapy, then you plan for your, if there is a residual tumor, you plan for surgery. If you can't operate in the residual tumor, you radiate the patient. So these are the another thing important about chest wall tumor is the reconstruction part. So obviously, as chest wall has a bone, soft tissue, and skin, you have to reconstruct accordingly. So skin is obviously you use graft. For muscle defect or soft tissue defect, you use flap like LD flap or pectoralis major flap, whatever rotation flap necessary, even if free flap if necessary. The importance in the when do you need a bony resection? So if your resection is less than 4 ribs, and if it is posteriorly located above the scapula, so at that part, chest wall stability is very good. So in those parts, usually you don't need a reconstruction. But for rest of the things, you will need a chest wall bony reconstruction, which can be done with a PMMC or that means methyl methacrylate, or you can use some bone cement or like this. So just keep in mind that small defect, 3 ribs defect, small length, posteriorly located in the upper part of the posterior chest wall, usually do not need a reconstruction because they are covered with scapula. They will get some support, but otherwise you have to reconstruct the bone also.
So please can you show the image once, please?
Which one? This one?
No, so the image, sir, for the question.
Chest wall tumor?
Yes, sir. Yes. Thank you, sir.
So can you tell me where this is located?
The third, between the third and the fourth rib.
And it is located little anteriorly, right? So this is a vertebrae. So this is posterior. So this is more or less in the anterolateral chest wall.